Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then what is superior orbital fissure syndrome? Superior orbital fissure syndrome is also called as Rochen Duvigneaud syndrome. This is actually caused by the compression of the structures. Whenever there is compression of the structures which are anterior to the orbital apex, this results in the clinical features. So here actually there is compression of the cranial nerves are seen which are passing through the superior orbital fissure. Through the superior orbital fissure, oculomotor nerve, which is superior and inferior divisions of oculomotor nerve, trochlear nerve, ophthalmic nerve branches like LFT, that is lacrimal, frontal and trochlear branches, and also the adjacent nerves, all these will pass through the superior fissure. So all these are compressed by the in orbital fissure syndrome. So as a result, the patient will develop the following clinical features. It is a disease of slow onset with proptosis is seen in the patient, and this proptosis is also associated with ptosis also. One important thing in superior orbital fissure is the ptosis is more prominent than proptosis. So ptosis will mask the proptosis. So we mainly see the ptosis, and proptosis may not be visible because of the ptosis. What is proptosis? Proptosis is protrusion of eyeball. Whenever the eyeball, if this is the eye, okay, whenever the eyeball is protruding, then it is proptosis. What is ptosis? Ptosis is the lid is drooping of eyelid is ptosis because of third nerve palsy. Now, along with that, there is decreased corneal sensation is seen mainly because of the ophthalmic branch of the trigeminal nerve um, due to compression of the ophthalmic branch of the trigeminal nerve, and along with that there is also ophthalmoplegia is seen, that is weakness of the extraocular muscles are seen due to third, fourth and sixth nerves. So this is called as superior orbital fissure syndrome or Rochen Duvigneaud syndrome.
thank you and thank you for watching.